Hello, Mrs. Bodine. I'm going to be your nurse today. My name is Haley. I just want to check. Can you tell me your name and your birthday, please?
Kaylin Bodine, 9982.
All right, thank you. And could you tell me how you're feeling on a rate of 1 to 10 today, 1 being the least?
Probably a 3.
Okay, so today what we're going to do is dress your wound. I'm going to take your dressing off and then give you a new one. So first I'm going to raise you up to my height for a comfortable position. Okay, and then I'm going to place a pillow underneath your leg so I can have better access to your wound. Okay, and now I'm going to put my gloves on. Okay, so we're going to take your dressing off. Okay, so your drainage looks good. It's just a little bit red, so we call that a serous drainage. Okay, and now I'm gonna just inspect your wound. Not really any inflammation. It looks good. It's healing well. Now I'm going to measure your wound. So at this point, when I measure it, I would take the width and the length of the wound, and then I would mark my chart later on. And now I'm going to prepare my sterile field. Okay, and now I will start opening all of my equipment. I make sure to stay away from my 1-inch border. And I always make sure to keep my arms above my waist. Okay, and now I will take the normal saline and put it on my 4x4s, making sure to go around my sterile field and to pour away from the label. And then I would time and date my normal saline. Now I'm going to put on my sterile gloves. So I will first put my glove on my dominant hand, and with my non-dominant hand, I will grab the outside cuff and lift it up. And always make sure my palm is facing up. Okay, and then I take my 4 fingers and put them underneath the cuff and place my non-dominant hand in the other glove. Okay, and now I'm going to clean the wound. I take my 4x4s and I make a little wonton. And then I would clean inside the wound from least dirtiest to dirtiest, and then I would throw this away. And then I would take my other gauze pad and clean the wound on the outside from furthest away to me to closest, and then throw that away as well. And now I'm going to pack the wound. I take one of my 4x4s and I completely unravel it. And then I put it in my palm, leaving just a little bit out. And I take my Q-tip. I did make one mess up, I'm sorry. Before I would pack the wound, I would take the Q-tip and put it inside the depth of the wound, and then I would break a piece off and measure it later. Okay, continuing to pack the wound. Okay, so now I have packed my wound. And now I will take my dry 4x4s and split them in half. And I will place them on top of the wound. And then I will take my ABG pad, making sure to touch only the outside flaps. And then I will place this on top of the wound. And then I will remove my sterile gloves. And I will close the Montgomery strap on the wound. Okay, and now I will remove the pillow on your leg. And I will cover my patient back up. All right, Mrs. Bodine, on a scale of 1 to 10, how are you feeling now?
I think that's just a 1. It feels pretty good.
Okay, that's great. So I'm going to leave now, and the doctor will begin to check on you in a little bit. If you need anything, here's your call light, and I'm going to raise you back to a normal.